Starting a new job can be super exciting, but at the same time, it can be so draining that if you're not careful, you will end up hating or getting depressed in the same job that you were so excited when you got the employment. That is why we created this video, so that we can share tips on how to settle in your new healthcare or nursing role. Hi beauties, what's up, and welcome back to my channel. It's your girl NurseNg. So in today's video, we'll be talking about how to settle in your new job roles. If you got your job, say in the UK, or you're relocating from abroad, countries like Nigeria, Ghana, Kenya, India, this video. First thing I'll talk about in this video is for you to take advantage of being a newbie. Yeah, you know, the first week you started your job, those orientation period where they're showing you how to know the company, how to familiarize yourself with the environment. That is the best time to settle in a company. Don't be afraid to ask any question you have. Ask as many questions, because people will be so happy to answer your question during this period. And also, it's better to ask plenty questions when you're beginning a job than not to know something basic down the line. Say you've stayed like 3 months or 5 months, but you don't know where they keep a dressing pack or where the sluice is. Ask your question now. The only thing I will say is that find the right time to ask your question. Don't start asking questions when you know the nurse is busy with the medication run or meal time, or when the shift is busy and then you want to start throwing up questions. No, find a better time to ask your question and people will be so happy to answer you, okay? Also, prioritize your learning. There's a lot to learn in this care job. So knowing what you want to achieve each day will help you to catch up with your learning milestone. All right. Another point that will help you is for you to write things down. You know, basic information that you know you will keep making reference to. For example, the printer code, the code to the door, where they keep some keys. You know, basic information that you will easily forget. Write it down in a small book that you come along to work with, so that once you forget them, you go back there and, you know, catch up with the information. It will be really offensive to your colleague that you keep coming to them every time to ask the same question. Like today you come in and you ask, where is the thickener? They will tell you. Tomorrow you come back again, ask, where is the thickener? No, write it some basic information down. That will help you, you know, to avoid being a burden. Second point is for you to be authentic. Don't be afraid to showcase your personality. You know, people will get to love you for who you really are. The truth is that you'll be in this company as a carer or as a nurse for a very long time. So start from day one to be yourself. Don't pretend, because people will get to know who you are anyway. So be yourself and enjoy your new job role. Let people discover you for who you are and accept you that way, okay? And the truth is that they welcome cultural diversity and differences. So don't borrow accents if you don't have one. Just be yourself. You'll be happier that way. Another thing I would say is for you to listen to understand. Don't be so quick to talk. People are talking to you. Instead of you to listen to understand what is said to you, you are just listening to reply. Don't be quick to talk. Be quick and listen and understand. Understand both the verbal and non-verbal thing they are saying to you, because in this health job, there's a lot that is said. The patient is speaking to you, the relatives are talking to you, your colleague, your manager. So always listen to understand. And if you don't understand, ask them to repeat themselves and get the information, okay? So with that, you know you're making the right decision and you're reporting out and documenting the things that are really important. The fourth point is for you to get to know the building and your patient. This skill will save you a whole lot of time and stress doing your job, okay? From my own experience, I remember when I started my job role, I didn't know which way leads to another. They will ask me maybe to go to a medication room and get something. I will keep going around the building. In fact, sometimes I will get lost and I'll have to use the buzzer for them to come to my rescue. So please, I know it's a lot of information, like I said earlier, but take your time, know the building, so that once you want to go to, like, from the kitchen to office, you know how to get along easier, okay? Also, this applies to your patient. Knowing your patient is one of the keys to enjoying your job. Like if you know Mr. A likes black tea and Mr. B is hoisted, or Mr. C uses the Zima frame, you know who works and who doesn't work, you know who has special chair, who has hearing aid. This will help you a whole lot to start enjoying your workplace. That's why I said it's a lot of information. Take your time, yeah, but focus and prioritize to know your patient. It will help you to give them the best care they need. Okay, next point is for you to adapt a learning or a growth mindset. My dear, take each day as a learning day. When something happens in your shift, whether good or bad, once you get home, reflect on it. What am I to learn from this? If it's a good thing, you improve and keep doing it to get better. If it's a bad thing, you list ways on how to prevent it never to happen again. And that will make you happier. Instead of having a fixed mindset where you get home, you'll be grumbling about what happened. And then you lose the lesson, the key lesson that you're meant to learn from that. So always learn from your incident, whether good or bad, and improve on how to get better. Okay, so the last point is for you to keep a positive mindset. This will make your job less stressful. It will help you to be at alert and offer your residents the compassionate care that they need. You know, all those people that like to complain, those negative people that will grumble, complain at every little thing, avoid them at all costs. When you start interacting with such people, what this will do to you is that it will start having impact on your mind even before you know it, and you start complaining. You be like them, you start complaining as well. You start, being so negative. Befriend such people from a very far distance. Okay, and another key that will help you is to take care of yourself, pamper yourself, take yourself out, do things you love. If you like going to the movies, make time when you're off and go to the movies. If you like going for a walk, then make out time and go for a walk. Those extra activities will keep your mind happy, and it will help you when you come to the work environment to actually carry out your job to the best way you can. All right, I hope these few points helps you to settle in your new care or nurse job role. And thank you for watching the video. Don't forget to subscribe to my YouTube channel if you haven't. Turn on post notifications so that it will notify you once we post a video. Thank you. Remain safe and see you in my next video. Bye.